So next generation sequencing has changed a lot over time, and I anticipate that it will change again in the next few years. We know that there's sort of candidate gene testing, and that's when people think that there are high likelihood mutations that they look for, and you've seen 50 gene panels, 75 gene panels by our traditional vendors like Illumina, Caris, Foundation, Thermo Fisher. And those are candidate genes. What has emerged is there are groups doing either whole exon sequencing or whole genome sequencing, groups like Tempus and NANT. I think that when you do more comprehensive testing and you're looking not just at candidate genes, you can decrease the sensitivity of detection of some of the candidate genes that are likely influencers of tumor growth. So there's some disadvantages of looking more comprehensively today. So today, with some of the next generation sequencing that's done with candidate genes, those are panels that people have where they take likely genes that could influence growth and development of cancer, and they test for those. I see that space really being disrupted in the next 2 years. So today, traditionally, you send off tissue to a lab that's centrally located, and you wait for results to come back, and it takes several weeks. What I see evolving in the next year or two is FDA approved tests that can be done in your clinic for under $1,000 that do candidate gene testing that looks at both DNA and RNA and tests for some fusion proteins in addition to other tests. And that's really going to disrupt this space. It's going to disrupt this space because it's looking, in my opinion, at the right things. It's going to be lower cost. There's going to be some aligned incentives for laboratories to do this testing, as opposed to pathologists having, variable knowledge about the test because they really just send it off for someone to do, and they don't have any economic incentive to be more knowledgeable about the test. So I see those things making next generation sequencing much more available to patients.